Welcome to Wellness Spring. Dear Dr. Derek Mahony, I know you are super busy and a very highly sought after speaker, so thank you so much for giving up your precious time to be here today.
Yeah, my pleasure. Thank you for the invite.
Pleasure. I'm so grateful to Patrick McEwen, the founder of Oxygen Advantage, for mentioning your brilliant work when I interviewed him recently. And again, when I did his Buteco breathing instructors course, and all the students were like, oh my God, can't wait to listen to the interviews. So many of them have heard of you, and some of them are your clients as well.
Patrick McEwen is really, I always use this pun, but a breath of fresh air. He literally has put what Buteco started many, many years ago on the world map. And I think Constantine Buteco, who I actually had the pleasure of meeting, was very much focused on the asthma side of things. But Patrick's taken this to a whole breathing well, whereas if you don't have asthma, you still will sleep better and your face will grow more favorably. And all sorts of things if you learn how to nasal breathe versus mouth breathe. And my passion, if you want to say, if you ask me the question, what's the one thing I could do to change the world, it would be to convert every parent who doesn't understand the dangers of mouth breathing into understanding the benefits of nasal breathing. So I thank Patrick very much for that. And he's a very humble, doesn't want to be in the spotlight type of guy. But his depth of knowledge is just second to none. So yeah, that was great.
Yeah, thank you. And I'm sure he'd be very pleased. As you said, he's very humble and he'd be looking forward to listening to this interview as well. And yeah, I've been blown away since I've been teaching various forms of breathing techniques for years. And recently finding out with SIDS, for example, the sudden infant deaths, a lot of those could have been avoided if someone noticed the high palates. And I know from your work looking, as soon as Patrick mentioned you, I Googled your name and I come across all the 60-minute videos. The one about the twins was phenomenal. And I think every listener should look at that, because the difference in the before and after is unbelievable. Like one having the traditional extractions and the other one having your preventative methods. What I admire about you, like Patrick, you're very humble and all the amount of research that you do. And could you please tell our listeners how you differ from other traditional orthodontists? Because I absolutely love your philosophy.
Yeah. Well, look, I trained as a traditional orthodontist. I trained in London at the Eastman Dental School, very prestigious center of learning. But unfortunately, the program there is very much focused on moving teeth, So if you had crooked teeth, I was taught that you just created room by pulling some teeth out, putting braces on and getting the teeth into the space you'd created. And when I graduated, which was, after 3 years, I thought, I knew it all and it was wonderful. And then I was just very lucky during my time in Europe to come across a colleague, Professor Sten Linda Aronson, who was back then researching what facial changes occur in kids who had nasal obstruction, in particular large adenoids, and kids who were breathing normally. And it was amazing, his research. And it really got me interested in this whole, what could airway have to do with growth of the face? So then I came back to Australia and I started practicing, and I was kind of, trying to find some more information on early treatment, on breathing, on facial changes, and nothing was happening in Australia. It was very traditional. It was like exactly like being back in the UK. And I thought, wow, Australia is such a progressive country. Surely this needs to change. And so I took a journey, probably took me a year, and I listen to everyone in the field. I listen to people like John Mew, who Patrick knows very well, and his amazing study on the twins, comparing again facial changes if you treat late versus early. And I listened to I met actually at one of John Mew's seminars a chap called Bill Hang, who has become a good friend and colleague of mine over the years, and he's another progressive orthodontist in the US who again now understands that if you straighten someone's teeth and you don't look at their face and you don't look at their airway, it's almost like rearranging the deck chairs on the Titanic. So I've gone from focusing on teeth to focusing on good breathing, a good looking face, which is a good airway. And this has become a passion of mine, not just in the way I practice now, but also in what I try and teach my colleagues and dentists and chiropractors and physiotherapists and anyone who wants to listen, to be honest with you. Because I think I read through one of your emails. You've been the victim of the old school orthodontics, much like me and much like John Mew. We've all had good teeth removed for no reason. I was able to, when I became a dentist, I actually went back to my treating orthodontist for work experience, and back then I still didn't have any clue about orthodontics. I was just out of high school. And I dug up my orthodontic dental records, which I ended up keeping. And when I graduated as an orthodontist and started learning newer techniques, I realized what a horrible treatment I had. I had very mild crowding. I had a recessive jaw, what we know as class 2. And I should have had arch expansion to make room and encourage my lower jaw to grow forward. But instead, I had to wear this horrific device called a head brace or headgear that pulled my upper jaw, my maxilla, back. And to add injury to insult, they took out teeth to resolve the crowding. So, I'm very passionate about what I do because of that negative experience that I had. And I'm just hoping more and more parents, and I don't know whether your listeners are more professional people or mothers of kids or all of the above, but it's just absolutely criminal if people are still practicing this old school orthodontics. Not for the whole debate of, a good-looking face and a nice smile, but from the perspective of children's concentration at school and their sleep and their breathing. And, there's just so many bigger layers that I've now come across in my studies and in my own research, in fact.
Yeah, totally agree. And the only reason I mentioned the twins video is because you follow that principle and you do the prevention rather than the extractions and work on the face profile and improving the airway. And the video that I liked that you talked about, there was 6 orthodontics on 60 Minutes who had been given someone's x-rays of their dentals, and they all said, yes, they need minimum 4 teeth out. And you, as a very young orthodontist, said, no. We have to try and save those teeth. That would be the very last resort. And
it's funny you mentioned that. That young child who I treated back then is now a very successful lawyer in Sydney. And I still keep in touch with his mum because she's lovely. And he's got. I think that was 20 years ago, maybe 25 years ago. He's a tall guy. He's over 6 foot. He's got this beautiful profile, and they're just so appreciative of what happened. But let me tell you, that was a storm in a teacup, that episode, because I was getting, threatening calls from my colleagues saying, "How dare you?" But how dare you ruin the profession? What are you saying? And I wasn't trying to grandiose myself. I was just trying to educate the public that there is a better way rather than just pulling teeth out. And a classic example, and the producer of that story did their research, and they in fact, the producer, she had 4 teeth out as a kid and had all sorts of problems with her jaw joint, and then put 2 and 2 together and realized this, and this is a really big story. And to this day, I think of all the 60-minute stories in Australia, at least, it's been the most watched thing. So I'm glad it changed a way that parents think, and now parents are coming in demanding early treatment, demanding non-extraction treatment. And, I wasn't there to in any way cause animosity amongst my professional colleagues. It was there just to say, look, there is an alternative. And at the end of the day, what's wrong with the parents seeking an opinion? But I think a lot of orthodontists who rang me and made, very, very disparaging comments were those who the week following that airing of that program had patients cancelling their appointments that were booked in to have teeth out. It was quite extraordinary. But things have changed a lot in Australia since that story. I've met a lot of younger orthodontists now who are very much doing what I do, which is great to see. And I'm not sure in the UK, when I speak to my good friend and colleague John Mew, he still seems to think it's gone back to what it's been for years. But what a shame and what a pity.
Yeah, I think the world is changing because a lot of people are into quick fixes. So maybe they don't want to do the work on themselves, all the exercises, involved, and they're quick for the quick solution of having extractions and the braces, but don't realize all the complications. And
I see that every day. I see people Invisalign has done such an amazing marketing around the world that people literally come in and they think orthodontics is Invisalign. And I say to parents, look, me giving your child some clear plastic aligners may make their teeth look nice for a while, but you're missing the bigger picture. Look at your child's jaw. Invisalign is not going to correct that. And then we talk about, their kids' sleep. That's always a good conversation starter. Does your child snore? How's your child's performance at school? What's his behavior like at home? And people don't seem to link this to their jaws, and it's very, very important. I remember if your listeners have ever read a book, it's called Your Jaws, Your Life, and it's by Dr. David Page, and he links all the relationships of many systemic health disorders to having a jaw problem, and it's very, very good reading. Things like a higher chance of bedwetting when you've got a narrow palate, obviously the sleep apnea of the recessive lower jaw, but increased chance of grinding your teeth, increased chance of jaw problems. And it's very, very good for parents to understand that it's not just about straight teeth. It's about giving your child the best you can give them and the time to treat. That's the other controversy. Parents always say to me, look, I had braces when I was in high school. Why is it we're treating young Johnny while he's still 7 or 8? And I explain to them, because what we're trying to do is change his facial growth. And by the time young Johnny gets to year 7 or 8 in school, that's already finished and we've missed the boat. So it's very important to educate parents because, mums want the best for their children. I've never met a mum in my 35 years in the profession who've come in and said, look, I just want the cheapest option for my kid. I don't really care about the consequences. They all want the best for their kid. And I find many of them are possibly getting shortchanged because they're not being given these options. And that's what John Mew has been so passionate about for so many years in the UK, much to the detriment of his own career, where, I guess, shall we call them the powers of darkness there, have tried to revoke his license because he's kind of like that prophet in the wilderness. And I just think it's everyone has the right to make their own decisions, and they need to be given enough facts in that regard. And the more you read, and I know you've read a lot outside the box, the more you realize that this is just common sense.
Yeah, and I think a lot of people are lacking common sense today. They're so quick to look on the internet, look on Google, they're addicted to their phones, and they believe everything they read rather than doing their own research. So I like to call them sheeple because they just follow their friends, and if so-and-so said it, it must be right. But I think from marketing research, I know where people, the highest amount of money is on children, pets, and women's cosmetics. So the parents will spend on the children, and they do want the best, but I think what is missing is educating the parents to know what is best for them. So I know you mentioned just now that you're happy for anybody to listen to your talks and all the practitioners and physios and so forth. But do you educate parents, or do any talks anywhere, any live talks maybe for parents, just to know what's happening? Because a lot of people don't realize the facial structure and the airway just from doing, I come from a nursing background, so I know a lot of people don't know anything, and doing Patrick's course recently was good to revise on just about all the nasal structure, the lungs, the alveoli and so forth. And most people don't know that, you know. And
look, unfortunately, I would say I haven't spent that much time talking directly to parent groups, etc. But I have obviously put a lot of stuff on YouTube and Vimeo, for parents to learn. I guess just my calendar and my gig is so busy as it is, lecturing around the world, and with COVID, I've had to defer things that I'm catching up with. But I always try and tell parents to look at some of the research, and it's actually very well documented stuff nowadays on the benefits of early interceptive treatment. I mean, I'm a member of the American Association of Orthodontists, and they're very progressive, and they on their website have a great 2 pages on when to bring a child to an orthodontist. And they talk about airway, and they talk about narrow palates, and they talk about facial growth changes while your child's 7. So that's great. That's like a breath of fresh air. And I'm just hoping that sort of attitude would have made more in other orthodontic communities. But for a parent, it's very hard, isn't it? Because parents, mothers in particular, mothers will listen to other mothers and maybe be influenced by, the parent-teacher association type group. And unfortunately, someone might have ended up with straight teeth and not realized that there's a consequence of those straight teeth. At what cost have they been straightened, and when they ask their friends at school or children who are in treatment who their orthodontist is, they're not really discerning into looking for what they're looking for. So I think I always say to parents, when you meet an orthodontist for the first time, ask them, what are their views on early treatment? Ask them, have they done any further studies in airway and facial growth and development? Ask questions like that. And if the response is, look, no, I only treat kids when they're in high school. No, I don't believe there's any link between the growth of the jaw and the breathing of the child. That's the practitioner you don't want to be associated with, So, I think the best education for any parent is to watch that twin study and look at what happened to. And it wasn't just on the story we did. It was one set of twin, but there was a large number of those twins that have been followed up for a long time. And the sad thing is, when I've chatted to some of the twins, and I had some twins in my study, the saddest thing was they said the good thing about the way we had orthodontics, at least our friends and family can finally tell us apart, right? But the sad thing is the twin who had the teeth out always said, geez, I wish I looked like my sister or my brother. So that's kind of terrible if you think what we could offer. And the reason John chose identical twins for the study is because a lot of orthodontists say, look, that's not our fault. That was just unfavorable facial growth. That's the classic term, unfavorable facial growth. Well, if you have identical twins, how can you then talk about unfavorable facial growth? Clearly, there's epigenetic or environmental factors that are influencing this, such as breathing, such as posture, such as the type of orthodontics you had. So I think it's very important for parents to look at that sort of research and read a little bit outside the box, because if they're purely just going off, word of mouth, if that's the right word, then probably they're not going to get the right advice.
That's great. I actually taught 2 young brothers this morning at 4 and 5, and I told their mother about you. So hopefully, myself and other people from the Potato group will spread the word, because I know they're all super excited. And just for the listeners, I'd like to just give them your bio. So Dr. Derek Mahony is a world-renowned specialist orthodontist who has been in private practice for over 30 years. He has built his practice and clinical teaching and worldwide reputation in offering early interceptive orthodontic treatment. Dr. Mahony is an invited reviewer for many dental journals in the field of facial development and its association with nasal breathing. He has been involved in leading research linking maxillary arch expansion to reducing a number of systemic disorders, such as bedwetting and ADHD, which you mentioned earlier. And I know a lot of parents will enjoy this talk just for the education side, because I'm sure they're not going to relate those systemic disorders to their child's oral health. And I was just wondering, because obviously mainly doctors would refer, dentists would refer clients to, but for those reasons, the systemic disorders, would doctors refer to you as well?
Yeah, my biggest referrers are actually my ear, nose, and throat colleagues, because they see the kids who have the nasal obstruction and they see the impact that has on the development of the upper jaw. So in basic terms for parents, when you breathe with your mouth closed through your nose, your tongue sits on your palate. And people can just try that now. You know, if you drop your mouth open and breathe with your mouth open, where is your tongue? It's in the lower jaw, where it shouldn't be. Whereas if you close your mouth and put your lips together and breathe through your nose, you find the tongue sits up on the palate. And here's the problem. The longer you leave it, the harder it is for the tongue to ever do that. I mean, I have so many people now who contact me who are doing what's called mewing. And I'm not sure whether you've discussed mewing in previous podcasts, but mewing is something that John's son, Mike Mew, has developed and been very big on social media. And it's an ability where, you know, we go to the gym, we work out, and we know that at any age, if you go to the gym and you pump iron, you can improve your biceps. We know that, right? But no one seems to understand that you can also achieve such changes with your tongue. Your tongue is one of the most powerful muscles in the body. And by putting your tongue in the right position and exerting the right force, it's a very specific technique, you can actually improve lots of things in your facial profile, improve the quality of your sleep. One of the people who influenced me in my research in pediatric sleep apnea was Professor Christian Goumeneau. And before he passed away, he's the father of sleep medicine. I mean, Patrick knows him well. Patrick and I both spoke on his program in Bordeaux many, many years ago. And he was passionate about people understanding that when you're treating sleep apnea, you're treating a muscle collapse. And the best way to prevent that is to strengthen those muscles. And he always used to quote that classic research from the British Medical Journal, I think back in '88, where they showed that one of the best ways to stop snoring is to learn to play the didgeridoo. That's amazing. Why? Because the muscles that you are using in playing that instrument are the same muscles that collapse. So I'm all about not just fixing the airway, but I'm about rehabilitating it. Because if you don't rehabilitate those muscles, everything else you do is going to collapse. I mean, Tom Graeber, who was the person who was the chairman of the American Orthodontic Association for many years. His son is also an orthodontist. He in his first editorial, when he was editor of the prestigious American Journal of Orthodontics and Dentofacial Orthopaedics, you know what he said? He said, there's a war in orthodontics, and it's a war between tooth, bone, and muscle. But no matter what you do, muscle always wins. So how many orthodontists are praising perverted muscle activity, poor swallowing, poor posture? We know that that's one of the major causes of what's causing the facial skeletal problems and the malocclusion, yet we seem to be fixing the symptom. We're not really treating the underlying cause. And I think that's very important for parents to understand.
Yeah, I was going to ask you, what role can parents play in their dental health and their oral health? Because I know from experience, a lot of people start off really well with my breathing exercises. And when they start to feel well, they stop, and then of course they revert back to the bad habits. So what can parents do?
Yeah, look, parent education starts from pre-birth. So, mothers to be should really understand the importance of breastfeeding and understand that even though WHO guidelines are 6 months, some of the studies have shown 2 years of breastfeeding are actually ideal, because when your child breastfeeds in the appropriate position, head upright, etc., they're actually encouraging all the muscles of their face to develop properly. So you can't mouth breathe as you breastfeed, right? Point number one. Point number two, to get the milk, you have to push your tongue up in that palate. So it's like an early form of mewing, if you want to call it that, right? Yeah. And I've seen children who've been breastfed 3 years, 4 years. They don't have a malocclusion, they have beautiful developed arches, because their parents don't realize that when your children get their first teeth, so we're talking they breastfeed, then they are off the breast, and now they're starting solids, when their teeth are up. A good dentition, a good arch for a child who is 4 years old, is gaps between all the baby teeth, because obviously the adult teeth are bigger, so you need that extra room. And so many parents are aghast when they see their kid who's got beautiful straight teeth at 3 or 4, then at 7 or 8 develop such crowding, and they wonder what happened. Well, what happened was that even at 3 and 4, it could have been predicted that their palate was too narrow to accommodate their teeth. What else do parents need to know? Pacifiers, no matter what anyone calls them, don't believe that story about the orthodontic pacifier. It's total makeup, right? Any pacifier is encouraging your tongue to go in the wrong spot. So you're encouraging what we call a tongue thrust. So your tongue should be hitting your palate in swallowing. You should breathe through your nose. Children who are bottle fed or use a pacifier or suck their thumb, they develop the wrong tongue posture. So what's happening is their buccinator or their cheek muscles takes over. The tongue's not doing its job. So that abnormal swallowing, that abnormal breathing is squashing their top jaw, and they're developing more of a malocclusion day by day. And it has a roll-on effect on the lower jaw, because when the top jaw becomes constricted, the lower jaw drops back. So these are the sort of things that I think parents need to understand, that if you want to do true interceptive orthodontics, you've got to intercept at a much earlier age. You've got to look at your child's sleep. Are they sleeping with their mouth open or closed? You've got to look at their child's posture. Do they have a forward head posture to compensate for their poor nasal breathing? There's simple tests you can do. Measuring the width between your child's teeth gives you an indication of whether they're developing a high palate. And John Mew is very big on using a ruler to measure from the tip of your nose to your child's upper incisor. And it's called the Mew Indicator Guide. And it's a very good guide to pick up these problems very early. So what parents can do is look at their child's breathing. Is it mouth open or closed? Look at their child's sleep. Look at the development of their child's jaw. And really be proactive in saying, listen, things are not developing as far as I can see the way they should. So, maybe we should find out what's going on. And some of the best things a parent can do is fix their child's airway. If they can resolve whatever it is, whether it's an allergy or whether it's, inflamed lymphoid tissue, adenoids, tonsils, or whatever that is, if they can change that early, and here's the thing, and then re-educate the brain, right? Because I have many very good ear, nose, and throat doctors who feel their job is done once they've cleared the plumbing. So I have ear, nose, and throat doctors who tell me, we've taken the adenoids out. There's no reason why Johnny shouldn't be able to just now breathe through his nose. But we all know that simple removal of the adenoid in a 7-year-old doesn't mean that their breathing pattern will change. For 7 years, they've been a mouth breather. We teach our children how to talk. We teach our children how to walk. We've got to teach our kids how to breathe properly. And I think what your group is doing is fantastic, because, when I started getting into Buteyko and breathing well, I read outside the literature. I realized this is nothing new. If you look at what Confucius was saying with yin yang and where the tip of the tongue should be, and you look at all the ancient yoga techniques, they're all deep breathing. They're all about the tongue being the right position. So it's just taken us so long to wake up to what has really been there. before, I don't know, is it the word modern medicine came about. I think that deeper breathing that the Buteyko technique teaches, because as you well know, there's so many children who overbreathe. They shallow breathe, and their brain is set into that mode. And as a result, they need to drop their mouth open. I mean, we can talk about carbon dioxide. And when I do sleep studies for children, I'm looking at what's called endpoint titration. In other words, what oxygen exchange do they have and what CO2 levels do they have? Because CO2 is an important determinant of regulating the body's pH and the breathing and et cetera, et cetera. So, so much to, I mean, that's launching into a whole nother topic. But I mean, do you recommend to your readers some of Patrick's books? Because they're really good. And there's a couple that are written specifically for parents. And I gained a lot of knowledge from reading those even before I met Patrick.
Thank you. And besides the children, because a few of the students asked me, some of them have got crooked teeth, and, my partner always laughs about people in Britain. He thinks most of them have got really bad aligned teeth. Are they too old for them to make changes now? Because I believe the cranial sutures don't stop moving until we're 80.
Yeah, look, you're never too old to have something done with your teeth, but unfortunately you miss the natural growth and development of your face when you're an adult. That's what it comes down to. And many people have, including myself, we have been able to widen an adult's palate at any age, but it's a different way of doing it, I don't believe that mewing has as good appreciable change on a non-growing individual as a growing child. I believe when you expand in a non-growing individual, there's more chance of the teeth tipping rather than the jaw changing. We use newer techniques. I'd love to introduce you to my good friend and colleague, Professor Wan Moon, who's developed a technique specifically to develop adults' palates that are narrow and can't breathe properly. And it's not surgical, because up till now, if you were an adult, if you and I wanted to have an ideal palate and broad jaw, unfortunately, we'd be on the realms of doing like surgical expansion, which is a big surgery, right? It's called a Lefort osteotomy. And I did many of those. But now I use a technique that Wan Moon has developed, where you put these things called anchor points in the palate with local anesthetic. There's no surgery. There's no going to a hospital. And you get tremendous changes in a lot of the adults. So the answer is, yes, you can do things with adults, but the results are not going to be as great as the growing child, because growth is against you. However, that's not to say, well, you're an adult, you've missed the boat, there's nothing I can do. Just don't be an adult who thinks that lining your teeth up with whatever brace is currently available, whether it's an Invisalign or a modern bracket, is going to give you those changes. It's not. It's going to be working with your breathing. It's going to be developing your upper jaw. It's going to be postural changes of your lower jaw. I have many adults I treat for snoring, where I make them a simple appliance where it holds their jaw forward at night so their tongue doesn't flop on their palate. Many mums and wives listening, if your husband's snoring at night, that's not a good thing. There's a chance he's probably not breathing well. I always say, I asked my mum once when I was, before I even did dental school, I said, Mum, what would you like for Mother's Day? And she said, if you can get me anything to stop your father from snoring, it'll be the best Mother's Day present ever. And that always stayed in the back of my mind. And, and you talk to the average lady whose husband maybe 45 or older, having a few more drinks before he goes to bed, maybe putting on a few more pounds. And of course, his sleep is disrupted. And unfortunately, his noise of sleeping is affecting her sleep. We all know that. But it's very simple things you can do even at that age to change the jaw without doing surgery. And it's all about keeping that tongue away from the palate. So I do a lot of non-surgical development in my adult patients. I do postural awareness changes of their jaw, and I make them appliances they wear at night to keep that jaw and that tongue away from the back of the throat. Because a lot of these people, particularly adult males with big neck sizes, effectively their tongue is choking them during their sleep. and changing their tongue with things such as mewing or myofunctional therapy is what it's all about. And then there's a whole other conversation. So many of these people have never been checked for tongue tie. So, you know, even though they want to do these exercises, they physically can't because their tongue is stapled to their palate. So many of these people want to do these exercises, but they can't get their tongue up because their palate's so narrow, you know. So it is a combination therapy of widening the palate, making sure the tongue is mobile, and breathing through your nose. And if you can do that at any age, you will see an improvement. But you can't say the improvement will be as great as the growing individual. You know, the magical age, if you want to get forward growth and get all this fixed early, is between 7 and 9. For some kids, I do it even earlier if they have sleep apnea and you know they're facing a long-term CPAP use. But on average, 7 to 9 is where you're going to get all the benefits of what I'm teaching and preaching and talking about. But don't be disheartened if you're 30 and you have all these problems I've discussed and you think, oh, geez, you know, I can't do anything. I've missed the boat. You can, but you've got to come in there realistically of what is possible and what's not.
Yeah, because it's very disheartening for people, you know, when they say, oh, my parents didn't have money, or my parents didn't care, or my parents, you know, blaming the others. But, you know, now maybe they're a bit financially better off and they want to make those improvements, especially, you know, there's so much divorce, and when people are on the single scene, then they want to make improvements. So those are really good
I remember
tips.
treating a dad of 3 young boys who I treated over the years. And 10 years later, he came in himself for a consult. And he said, look, I've been strong in my life. In my first marriage, it didn't really worry me. But now I've got a younger bride, and she's complaining about snoring, and I'm taking it seriously. So I hear what you're saying. And is your husband Australian when he said he laughs at English teeth? No.
Yes.
He is, right, yeah. Because I always remember that famous episode on The Simpsons. You remember the English Book of Smiles? And they were using it to scare, I think, one of the kids. And I guess it's changed a lot. But when I trained in England, I would say certainly having crooked teeth wasn't necessarily a big thing, right? Not like America, where everyone needs to have that Hollywood smile. But again, the focus has shifted from the straight teeth to, well, what about the benefits of your sleep? What about the benefits of chewing without jaw clicking? What about the benefits of sleeping without snoring? So I think the whole focus has changed, and certainly in the UK, there's quite a big movement on holistic, you know, dentistry and holistic medicine, and getting away from the over-medicated, you know, where you go to a doctor and every ailment you have has some sort of prescription with some tablet to cure it. Well, you know, we know that that's not always going to help. And one thing Constantine Buteyko showed, that, you know, there's 2 things that happen. When you come into this world, you'll take your first breath, and the last thing that happened before you die, you'll take your last breath. And it's the number of breaths you take in between that first and last breath that really improves or determines the quality of your health. What a powerful statement. You know, what a powerful statement.
Yeah.
And I just think people find out too late. And I do get a lot of patients who are so upset. They said, look, why didn't my orthodontist talk about this when I was younger? Why didn't my parents take me to someone who expanded my jaw rather than take TCAT? I get all that, you know, and I feel sorry for that person. But that's not to say, well, look, I'm just going to be miserable all my life and pervert that misery to other people. You can do lots of things to improve your health, and you know, talk to other people about your negative experience and explain to them of what you could be doing, what is a better option. You know, there's all these things. But I mean, you could write a whole book on all those poor old people like yourself and myself and John Mew who had old style orthodontics. And back then there was no alternative, I guess. But right now there sure is, and it's terrible that people are still allowed to get away with this sort of treatment.
Yeah, I totally agree. And I'm consciously aware of the time, so I just wanted to say very quickly, because you're not only an orthodontist, you're a businessman as well. And I know you've got 5 practices here in New South Wales and 1 in Melbourne. So if there was someone starting out, what tip would you give them?
Well, I think the biggest tip if they're starting out in my profession would be to um, uh, learn about airway. I never had one lecture on airway and the importance of breathing during my 3 years as a postgraduate student or my 5 years as an undergraduate student, right? I was just, as I said, I believe in fate, and I believe that I was in the right place at the right time. I was dating a lovely young woman from Scandinavia, specifically Sweden, and I spent a lot of time in Stockholm. And during my time there, I met one of my colleagues, as I said, Linda Aronson, who started talking all about airway is more important than anything else. Think airway first, teeth last. And so I was so lucky to have that early in my career because, so I'm saying, doesn't matter where you trained, and if you didn't get any lectures on this, don't blame your faculty. Blame yourself for not then thinking outside the box and taking other courses. I mean, John Mew, God bless him, is 94 years old. You listen to him before it's too late. There's just so many things. So I think if you're a young orthodontist starting out, two things. Number one, you've got to treat early. You've got to understand the benefits of early treatment. Number two, you've got to understand all about sleep. Because if you're treating a malocclusion, you're actually treating an airway problem. My PhD research, we looked at, 3,500 or so children who had malocclusions, who referred to me because of bad bites or crooked teeth. And we did one thing different. We had sleep studies for these kids, and we gave the parents a Bears questionnaire to ask about their kids' sleep and behavior. And we found, over 90% of these kids actually had sleep disordered breathing problems, right? OSA is the worst one, but many of them didn't have OSA, but they had snoring, they had mouth breathing, they had upper airway resistance. So there's definitely a correlation between the two. So I just feel you can't train as an orthodontist unless you have parallel training in airway and breathing. So that would be my big tip to a young graduate.
Thank you very much. And thank you for all your wonderful tips that you've given tonight. And I will share your website and all your social media links with the show notes so that people can contact you. And can people contact you directly, or do they need to have referrals for sleep studies or just a consultation?
No, I mean, the law has changed now in Australia. You don't need a referral to see a specialist. In the past, you had to get a referral from your dentist or your doctor. You can self-refer. So most people find me really through my website, which is fullfaceorthodontics.com.au. Pretty easy to remember because that's what I try and promote, a full face. So Full Face Orthodontics, and yeah, through that website, we get lots of people. And I love helping people, even though I may not be able to physically treat them. They might be in Norway or, somewhere. I'm more than happy to give my advice and put them in touch with like-minded colleagues that I've met. I've traveled a lot. I'm very lucky to say that I've actually been invited and lectured in 120 countries in my 35 years. My bucket list is to make that magical one. I think it changes every year now, doesn't it? I think there's about 180 countries that are the UN recognizes. So I'd love to, finish that. But I meet so many interesting people, and I share ideas, and so I'm very happy, even if you don't live in Sydney, and if you're not going to come to my practice, to give you advice and point you in the right direction. Always happy to do that. If I can save one child from the negative experience I had with my orthodontics, I'd die a happy man.
Thank you. You're so kind and so generous. And thank you for all you are and all you do and all the wonderful work you're doing in the world. Thank you.
Thank you very much. And thanks for taking the time.